Hip internal and external rotation range of motion and the associated muscles are neglected, but they're critical not only for healthy hips, but also if you're dealing with knee pain or low back pain. Today, we're going to go through a unique and highly effective exercise you could do right now that doesn't require any equipment that'll wake up these rotator muscles like never before. Coach E for Precision Movement here, and you may be wondering, what is Coach E cooked up for us today? Well, we've got a great exercise to work those hip rotators, and whether you've got hip pain or knee pain or low back pain, this is an exercise you're going to want to put into your regular routine. And I'm going to talk about the theory, and I'm going to share a few studies with you after we do the exercise itself, but let's get right into it so you can feel just how powerful this technique is. Now, there are a few key form cues that you'll want to know right now before we get into it. First, we'll start with the precision movement ABCs. A stands for alignment. The alignment for this exercise is good posture with a slight anterior pelvic tilt. So if you start off in neutral posture, a slight anterior pelvic tilt is as if you had a cup of water on your pelvis and you're dumping the water forward. So just a slight anterior pelvic tilt, maintain that throughout. And this becomes even more important to focus on when you're bringing your feet from out wide to closer together. Number two is breathing. It's very simple. Just breathe in a relaxed way naturally throughout the exercise. Don't hold your breath. And the C stands for control. That just means to go slowly so that you control with your muscles every degree of range of motion. Now there's a couple other form pointers. When you're rotating the hips, you want to focus on rotating the thigh, not so much the foot, because the foot can move independently of the thigh, which can make it look like you're using those hip rotators, but you're not. You're using the tibial rotators. So when you rotate, you focus on rotating the thigh. You also make sure that your foot is pointing in the same direction as your kneecap. That will ensure that you have good lower limb alignment. You also want to make sure that your weight is centered between your left and your right feet. You're not on one side more than the other, so you keep your weight centered throughout, and you keep your pelvis and your shoulders square. So when you're rotating, you're not rotating your body, you're just rotating the thigh and making sure the kneecap points in the same direction as the foot. So those are the form cues that persist throughout the exercise. Now let's get to it. Stand with your feet together and place your hands on your hips. For external rotation, you're rotating on your heel. Then for internal rotation, you're pivoting on the ball of your foot. Make sure you're maintaining good posture with a slight anterior pelvic tilt and keeping even left to right weight distribution as best as you can. Activate those hip muscles to rotate the thigh, not the foot, and hold at the end range for a couple of seconds to really activate those muscles. Keep breathing naturally. You can look down to make sure that your knee is pointing in the same direction as your foot. You can go slower than we're going right here, but you can pick up your pace as you learn the technique. As you get wider and wider, make sure that you're maintaining the knee and the foot pointing in the same direction. You won't be able to rotate out as much the wider your feet get. Keep your pelvis and your shoulders square. They're going to want to start to rotate as you get wider. And keep going nice and slow. Keep breathing. Maintain that good posture with the slight anterior pelvic tilt. Once you're at the end range, it's time to come back in. And here we're going to start to bend our knees, but still maintaining good posture with a slight anterior pelvic tilt. For external rotation, we're pivoting on the ball of our foot now. And for internal hip rotation, you're pivoting on the heel. It's really critical to make sure that the knee points in the same direction as the foot here. So you can go even a little bit slower, look down and line up the kneecap and the foot. They're pointing in the same direction. The flashlights are pointing in the same direction. Keep pivoting, keep breathing. Relaxed. Keep the pelvis and shoulders square, even left-right weight distribution. And once you come to the end, pause for a brief second, then stand up. Way to go. Start off with 2 to 3 reps of this exercise done 2 to 3 times a week. And each week you can add 1 or 2 reps to further build your endurance and your control. When it comes to rehabbing patients who have problems that haven't been able to get resolved through traditional methods, one of our theories is that the body is broken down and there's pain in one area because another area isn't working properly. So here's an example. If you lack hip internal rotation, then you're going to have to get that rotation from somewhere. If you're a tennis player doing a forehand, you're going to need to rotate somewhere to execute the technique properly. So if your hip's not rotating, where else can rotate? Well, you could rotate through your pelvis or through your lumbar spine. And if you're always rotating through the lumbar spine and the hip's not doing the job because you don't have the rotation in the hips to do it, then that lumbar spine is going to break down sooner rather than later. Same thing can apply to the knees. If we're not rotating through the hips and we have to pivot, or say we're a soccer player and we have to pivot, and we don't have any rotation through the hips, then we're going to have to rotate through the knee. And the knee isn't really designed to do a lot of rotation, and that's where we can run into meniscus tears or ACL tears. So that's one of our guiding theories when it comes to rehab and corrective exercise and how we approach and look at the human body. Now, I'm going to get into some science and some studies that illustrate this, our theory of compensation, but in the research. So the first study I wanted to talk about, because it's just a really good recent review, is in 2023 in the Journal of the American Medical Association, and it's titled Evaluation and Treatment of Knee Pain, a Review. And they start off with a stat: knee osteoarthritis, affecting an estimated 654 million people worldwide, is the most likely diagnosis of knee pain in patients aged 45 years or older who present with activity-related knee joint pain with no or less than 30 minutes of morning stiffness. If you've got more than 30 minutes of morning stiffness, I don't know what to tell you. You don't need a doctor, you need something else. They also go to state that first-line management of osteoarthritis comprises of exercise therapy, weight loss, education, and self-management programs. Surgical referral for knee joint replacement can be considered for patients with end-stage osteoarthritis, i.e. no or minimal joint space with inability to cope with pain, after using all appropriate conservative options. The researchers also looked at meniscus tears and said that meniscal tears affect an estimated 12% of the adult population. Conservative management, which is exercise therapy for 4 to 6 weeks, is also appropriate for most meniscal tears. For severe, e.g. bucket handle tears consisting of displaced tissue, surgery is likely required. For degenerative meniscal tears, exercise therapy is first-line treatment, and surgery is not indicated even in the presence of mechanical symptoms, e.g. locking and caching. And this correlates with other videos where we've talked about this, and Dr. B has broken down not only the research, but her experience from over 30 years of being an orthopedic surgeon. Next up, I wanted to go through this study titled Hip Rotation Muscle Strength is Implicated in the Progression of Early Post-Traumatic Osteoarthritis. This study looks at people who have had ACL tears and then have gotten the ACL reconstruction surgery. They looked at 111 participants 1 year after surgery, and they completed hip external rotation, internal rotation, strength assessments. And what they found was that greater hip external rotation and internal rotation strength was associated with superior function at 1 and 5 years and better KOOS, that's a standardized study of knee pain and function, KOOS patellofemoral symptoms at 5 years. So this is really, really important to look at, because we see that people who've blown their ACLs, if they don't improve their hip external and internal rotation strength, even if they get the surgery, they've got worse knee outcomes, they've got worse function, they've got worse pain 1 and 5 years after the surgery. So if you don't fix the problem, the root cause, the true root cause, which is not, the blown ACL, they fix it up. But if you don't address the true root cause is, some of which could be hip external and internal rotation, then your knee is going to continue to degenerate and you're going to have problems again in the future. So you've got to get to those root causes. Next, let's go to the low back. And I found a couple of interesting studies here related to the exercise that I showed you earlier. The first is titled, "Is there hip muscle weakness in adults with chronic non-specific low back pain? A cross-sectional study." In this study, they found that patients with chronic low back pain tend to have hip abductors, adductors, and extensors weakness. The bottom line from this study is that general hip muscle weakness is associated with patients who have chronic low back pain. So the hips are really, really key to low back pain, which is why our low back pain solution includes more exercises for the hips than it does for the core. The fourth and final study I'm going to look at today is titled "Lumbopelvic Hip Rhythm in People with Lumbar Flexion with Rotation Syndrome During Hip Internal Rotation." And this is a really interesting syndrome that they've titled here, "Lumbar Flexion with Rotation Syndrome," which basically describes how if you have low back pain, then there's a subset of people who have low back pain because they have excess lumbar flexion and rotation. And this illustrates exactly what we've been talking about. In this study, the researchers revealed a significant increased pelvic rotation during the tests in those with low back pain. So the pelvis was rotating more in people with low back pain than in people who didn't have low back pain. The researchers also found there was a tendency for early pelvic rotation during the dominant hip internal rotation test. Basically what this is they looked at the gait cycle and they found that in those people with low back pain, their pelvis rotated earlier than those who didn't have low back pain. So basically there's more pelvic rotation and the pelvis is rotating earlier in those with low back pain than those without. Why is that? When your hip's not rotating, you don't have internal rotation of the hip, that rotation has to come from somewhere, and that can come from the pelvis and the lumbar spine. But when the pelvis and the lumbar spine are rotating more than they should, there's more forces going through there, and it's going to break down earlier. So these studies basically show our theory of compensation that we apply to all of our patients who come in with chronic problems that hasn't been resolved. My average patient comes in after 6+ months of suffering from problems and not having their problems resolved through the traditional rehab methods. So these people, we look at them and we see, okay, your hip's not rotating. You've got low back pain, but your hip's not rotating. You've got low back pain, but your feet don't work well. You've got low back pain and you've got no shoulder range of motion. These are the things that we look at in addition to the standard, what's your plank endurance score or what's your low back stability score. We've got to look above and below any painful area to try to suss out what the actual root causes are. That's why with our programs like the low back pain solution, you're doing exercises for your hips, you're doing exercises for your shoulder, you're doing exercises for your feet in the low back pain solution. We've got to make sure that everything is working right because we can't always identify perfectly, okay, this is the one thing that is causing your problem because compensations layer over time. You could have one compensation leads to another, and then finally something breaks down. We don't know what the order is. It's chicken or egg, which came first? We don't really care. We've got to just make sure everything's working properly that has a good likelihood of contributing to your issue, and that's how we're going to get the best results possible. So there is some research illustrating how important hip rotation is to knee health and to lumbar spine health. If you want to watch some more on these topics, we've got videos here and here talking about the knees and low back pain. But if you want to just get started on a progressive program that addresses all of the potential root causes of your issue, whether it's the knees, whether it's low back, then click this link here. We'll walk through a really quick questionnaire to figure out where you're hurting, and we'll provide you with our best solution to your problem.